I mean, you sound like you saw a lot of kids. You know, what kind of cases, pediatric cases, or what kind of things that did you see when you were there?
Well, we saw a lot of children. Very often, the parents are bringing the children to be seen, and sometimes the ones with an afterthought, they would want to be seen as well. The concern often was for the children. Parasitic infections were obviously rampant throughout the country. In a lot of these villages, people would scavenge for food through refuge or through waste. A lot of times the food is cooked on open air grills, which are very hot. There's not a lot of electricity or, of course, so they're often cooked over open fires. Every child that we saw, for the most part, was dealing with a small degree of malnutrition. We take enough worming medication for parasitic infections to treat everybody there, and we also take enough vitamins to give everybody at least a 30-day supply of vitamins, both the adults and the children. So we often would see that. We saw a lot of infections such as bronchitis, pneumonia, otitis. Thankfully, we didn't see a lot of children on this trip that were very ill, although on past trips we've had children that were extremely dehydrated, and some of them even have to require surgery for the treatment. But we saw a lot of, kind of bread and butter family medicine things, from otitis infections and pneumonia but also treating the parasitic infections for most of the children as well. Also, there were some children there who were overweight, one of whom, who I believe was pre-diabetic. There wasn't a lot of treatment we were able to give him, but I believe that was his primary concern. So we were able to see a lot of things. We also saw, several stigmata in either young adults or in children of diseases that in this country we now consider to be eradicated. I saw a young lady in her 20s who had scars for rubiola. She had a case of German measles when she was a child. And that was actually my first experience seeing a case of rubiola. That was very interesting as well.
So some stuff that you probably have never seen or have only seen in a textbook or on a board exam question, you actually saw right there in front of you.
Yes. We saw I remember an elderly lady in particular who had a case of elephantitis and chronic lymphangitis in her lower extremity. She had a parasitic infection which caused damage to her capillary and lymphatic system, and her right leg was about 3 times the size of her left. And I'd never seen an actual case of elephantitis until that time. That was very interesting. We also had a elderly lady who unfortunately had a approximate 6-inch fungating breast cancer that had erupted through the skin and was bleeding. She was unfortunately beyond any course of treatment that we would be able to offer her there. But you sometimes do get to see things that are you've never seen before in a textbook, or some of the things that you hope you won't see in the United States.
Wow, huh. So was it hot and humid there? Was it rainy there? What was kind of the weather like when you were there for that week?
We were in the dry season in Guatemala. There was no rain in sight. Most mornings are pretty pleasant, although most of the time, even at the end of March, most of the mid-afternoon temperatures would get up to be in the high 80s to low 90s. There's very little breeze in several of the places that we were. So the concrete building in San Carlos was actually probably one of the hottest we were as far as inside the building. It was probably 95 to 100 degrees as far as inside the building there. We had lots of bottled water, lots of things to drink and snack on while we were there. At El Chico, at sea level, it was probably 85 or so, but we had the ocean breeze from the Pacific Ocean. Then we went to Beachaba the next day up at almost 10,000 feet elevation. We actually wore coats because it was low 60s when we first arrived, although it did warm up to probably the mid-70s that day.
Huh. So what was the travel time? Well, like, how long did it get from home to Guatemala? And what was that like? Obviously there's a time on a plane and stuff, but how long was it from when you landed there to, where you were staying or where the clinics were?
We tried to reach out to the clinics to somewhat remote areas. We landed in Guatemala City. It was about a 4-hour flight from Charlotte, North Carolina to Guatemala City when we landed. The facility we stayed at in our home was about an hour outside of Guatemala City. The host there had a very nice bus for us, so we had a nice passenger bus to travel in. Our other clinics varied anywhere from 30 minutes away. We spent our first couple of nights, I mentioned, at the facility there, in our home, and we actually spent a couple nights in a hotel in a town called Renalao, which was a little closer to the Pacific side. That was about 2 hours away, about 3 hours away from Guatemala City. And we went out to El Chico. It was about a 2.5-hour bus ride, probably an hour 45 minutes of that on a dirt road with not much padding in the seats and a lot of jostling there. We then spent about 15 to 20 minutes on a boat traveling out to the islands. So that was probably our biggest travel day. It was about 3 hours there and back each way. So we spent about 6 hours in the lake and probably 5.5 hours on the road. So that made for a pretty long day. And when we went back to the hotel, we had a hotel that had a water slide and an outdoor pool. So we made sure to take advantage of that.
We have a few questions from our live chat room here. That's why I love this show. A couple of questions are: so what piece of medical equipment did you find most useful, and is there a piece of medical equipment that you wish you would have brought or you're going to bring next time that you would have found helpful?
You know, obviously, we took some of our own basic equipment. I had my stethoscope, my otoscope, and ophthalmoscope. I also had my blood pressure cuff. Because I do some sports medicine as well, I took a lot of injection supplies with me. Probably the most important piece of medical equipment we had was just our hands. There's a lot more reliance on your physical exam skills there than I think even we use in the United States. It was certainly somewhat exciting to get a chance just to help things or cut things and not have an x-ray but have to go off on a periscope to determine how to treat the patient. We did also take a portable ultrasound machine, and that was a great piece of equipment to have with us, particularly for the obstetrics. We were able to let several of the ladies there who were pregnant see pictures of their babies. Many of them had never seen an ultrasound picture of any child that they'd had. That was really a great experience and a great thing to share with them. We also were able to use it to diagnose some, benign fibroids and uterine tumors. If there's one piece of equipment I wish we had, I wish I could have taken something like an iStat or a portable electrolyte machine. We did have a finger stick blood sugar, and we were able to treat the patients with diabetes, diagnose a few cases of diabetes in elderly patients. But I'd love to have been able to get basic chemistries or hemoglobin things that you could do through a machine like an iStat. So that's a machine that I want to encourage the organization to purchase in the future so that we can have that available. That's a great question.
And another question is: so what language do they speak there? Did you know a little bit of the language, or did you rely a lot on the interpreters that were there?
The primary language in Guatemala is Spanish, and I know un poquito español, so I could say hello, goodbye, and thank you, and that was about it, as well as where is the bathroom. So we did rely a lot on our interpreters. One thing that was really interesting about this trip, and the one thing that's varied from one place to another is that there are other local dialects in Guatemala. In particular, there are some descendants of the Mayans that are still in Guatemala. So one of our clinics that we did on the mountaintop of Ichaba actually had primarily the Quechua Indians, and they actually speak their own language called Quechua. So on that day, in particular, and we had to go from English to Spanish to use an interpreter, from Spanish to Quechua to the patient, and then back for the patient who spoke in Quechua to Spanish to English. And that was a very interesting experience. I don't know what to relate Quechua to, except that I think it has some Far Eastern dialect to it, because there are a lot of clicks and pops and sounds that they made. So it was incredibly difficult to understand, and I had no clue as to what the patients were saying until it was interpreted back